We did group 1 and group 4. So what, if any, special disease surveillance approaches should be taken in communities where animals and human remains are surfacing from the permafrost? So there was some consideration that, we also have to think about subclinical as well as clinical symptoms that could arise. And that, it was basically, if we don't have a baseline, it's hard to interpret what some of these special disease surveillance approaches could be. And that, we need to think about the One Health approach, and could we be doing things in both humans and animals? And, is the goal to do surveillance and increasing local capacity, or is it primarily research? And there was a lot of debate about issues that will arise in the next column. But that every community has a certain risk, and we need to look within that risk profile for looking at what special approaches may be needed. So syndromic surveillance could be considered a special approach, but obviously we spent a lot of time talking about syndromic surveillance because it does lend itself to working in remote communities with direct community engagement, so that you can do some real-time surveillance by having the community be an active participant in such a system. There's questions about doing it retrospectively, how long it takes to get the data, or you could do it in real time. And that the system we saw this morning of the LEO network lends itself to, a great opportunity to add active surveillance to a system that already has users who are getting useful information, and could we build on platforms that already exist? Let's see, there was the idea that you could look at directly engaging the community, or you could think about, using healthcare networks, or, in some places people are looking at pharmacists who, have a finger on the pulse of the community. And then, of course, big data. We talked about how, Google, I was at Google when we created Google Flu Trends, and that was back when we just had search, but now obviously Google has access to everything on your Android phone, in addition to owning YouTube and other things. And now they have a new digital epidemiology team that is going to be looking at, can you look at the anonymized big data and look for not only disease threats, but other threats that have to do with, mental health and maternal child health. And so that's exciting. And other companies like Amazon with their artificial intelligence are looking at doing the same thing. There was a question whether the military could play a role if they have networks within these communities and building those kind of relationships, because there may be some sensitivity of what we're looking for in those communities. It was important that the community be part of whatever is being created, so that it's a co-production. You can see a lot of other things that we talked about, and then there was the big debate between what's research and what's surveillance, and could they be combined? But the last thing we want to do is be parachuting in and just doing things that are taking extractions from the communities without really helping improve their health as a part of it. And again, I'll talk about a lot of the existing networks, and could we be using one of those or some of those networks to actually build these, so we're not starting from scratch, and a lot of emphasis on really thinking about One Health. So maybe we should go to the next page. Oh, sorry. There we go. Should there become some kind of sentinel disease? So a lot of that was covered in the syndromic surveillance. Who would be part of that? But again, One Health is really important, not just the people, but we actually care about the animals. So we're trying to save lives and protect livelihoods, because that obviously impacts on human health. And then people talked about certain animals that could be good sentinels, like the Arctic fox, because they scavenge around long distances and they eat practically everything, so I've been told, as well as things like fish. So we saw some of those things coming from Leo, seem to be a lot about fish. So we kind of ran out of time on that one, but covered most of it in the syndromic surveillance. And then should certain diagnostic approaches be used? It was mentioned that in the wildlife, a great first step would be having clinical case definitions for wildlife surveillance. That doesn't seem to exist right now. What kind of surveys could help establish some of the baselines for diagnostic approaches? And again, it's the sensitivity of looking for something unusual in a community, and how is that really helping that community, as well as thinking about the global health security goal that we're looking for. And that, depending on what kind of diagnostic approaches you're using, if they require samples, the logistics of getting them from a remote thing, and then, thinking about what kind of diseases we're actually looking for, which then gets into the last question in group 4, which was, whoops, I guess I went too far. The whole genomic sequencing, like, is that an ability to kind of leapfrog if we don't have a lot of diagnostic tests for the individual diseases? Could either whole genome sequencing or other methods of sequencing actually help us identify if there was a cluster of an outbreak in a particular area? And we use the Ebola in 2014 as an example, because of those of you who have studied that. The big long delay actually was really the lack of diagnostics and the thought that it was probably malaria and that it was probably Lassa fever. And so by the time they actually introduced the diagnostics, obviously we found out it was Ebola, and that big delay led to 11,000 deaths, which we had never seen before in an Ebola outbreak. Standardized approaches about informatics became really important if we're going to look at genomic sequencing, and people talked about how everyone has big, ways that they look at I forget what the term we were using, but it depends on what system you're using, and are you going to actually get the same results if people are looking at their genomic sequencing in different ways? And the most important thing that people kept bringing back to is you have to have the trust of the communities before you get involved in anything. So we had a lot of stuff. I don't know if anybody wants to add to that quick overview of everything we talked about.
Yeah. I just love to use these animal examples, and to add the book for the articles, we don't need to make another bicycle. I usually choose the 10 flagship species, and articles is one of the top flagship species, showing concentrating of different risks of change. It's lemming cycles, it's human presence growing, it's shrinking ice, which we know they can go from flower to ellesmere, for example. So this is one single species is an indicator of different changes. So I'm really glad to see it. And more using this meeting and output from this meeting and the expertise of people in this room, I can, as a person who study artifacts, use it as one more argument that this group of bunch of people also share the feeling that artifacts could be a target species. So just to add that EUCN already do the job. We just add from their website why it is nice to study. Thank you.
That's good.
So we were looking at current surveillance approaches in the Arctic. I have to warn you, my brain thinks it's the middle of the night. Anyway, the first thing we came to was that basically the current approaches vary considerably by country and even by smaller administrative units within the country, states or territories, and even within states. For example, in Alaska, probably things are done a little differently in the North Slope borough than they are in some other parts of the state. Some parts of the state don't even have a borough. It's like state and then there's just village. So most of the as far as we kind of split into humans and animals because the situation's different. Most countries have state, county, countrywide surveillance programs for infectious diseases, and in general they work fairly well. In the U.S., states get to pick their own reportable diseases off a list of, there's recommendations by the CDC, but states get to do their own thing, basically. And it comes back, that's actually the case in Canada, too. So there's a couple Canadian territories that have not designated reportable species. So Finland kind of won. They seem to have a fairly comprehensive program. There seemed to be coordination between people dealing with humans and people dealing with wildlife and agriculture. Actually, the animals seem to they have a department that does forestry and agriculture. So, there was a little bit less, and they worked closely with people who did water quality. There's also less in the way of transportation issues, so when people do have samples, they can get them to a lab fairly quickly. Comms are good. And there's the food quality, the department that's responsible for food quality is involved. Other countries kind of, it's a descending ladder. Greenland basically kind of has to refer things to Denmark for higher level stuff and for labs. Canada and Alaska both have issues with the remote villages getting samples in. And the other thing that seems to be common to both of those is that a lot of the healthcare providers are locums or very new to the area, so they aren't familiar with what's regular, and they, are not, they won't necessarily pick up that something's out of the ordinary as quickly as you might if somebody had been there for 20 years. There's obvious exceptions. When it came to wildlife, not so much. Most countries don't really have them. Greenland, basically, there's 5 vets in the country, and each one of them kind of is their own little place. They don't have labs. They don't. It used to be connected to the human health department, but that was split off for various political reasons, and so they really don't have a lot of resources. Now, people will tell them about issues, but they don't have a way to deal with it. What do you do with that? There's no place to report it to further along. So the networks are pretty isolated. They're pretty closed. There's parts of it, Canada and Alaska, parts of it are handled by various parts of the state. There's parts of it that are kind of handled through research, but that's not a long-term sort of solution. So, and the big thing that seems to be pretty common everywhere is funding. Who's going to pay for actually running these tests and all just the shipping? There's a lot of no crossing of lines. Greenland, they certainly can't use. They have labs, but they can't use them for animals. So, we then kind of segueing into what approaches are being used. The research project versus surveillance program issue came up there as well. There's a lot of research projects and not as much in the way of sort of long-term things that are designed for surveillance, particularly for wildlife. It's not a routine system. Humans, yes, pretty much, but not so much with wildlife. Different programs sometimes deal with different pathogens, and some of them can only be tested for in 1 or 2 places, which for most of these places are very far away. So in Canada, sometimes samples would have to go from the community, to a regional office in a province, then it had to go to an office in a different province, and then it would get tested. And then the, preliminary results had to come back. This was particularly relevant in brucellosis because, the idea is you tell the people are supposed to just freeze the animal and wait, but that's really unlikely to happen. Things are shared widely. That's fairly common in all Inuit areas. I mean, that's a fundamental value is you share food with people. So, it goes everywhere. And that's a real problem if you can't get a quick turnaround that people are liable to eat it before you know. And if there's a problem, you really have a problem. So then we got to would the systems be able to rapidly detect emergence of new human pathogens? Human, yeah, probably when they got to humans. There were some concerns about more rural areas and certain types of things where, if it's a pathogen that causes stomach problems in most people, probably nobody would even bother reporting it. If somebody was running fevers that, they'd go to the hospital or to the community clinic and, get aspirin or Tylenol. And so they could go through several iterations before anybody even started looking at something. Research programs are great, but they're not a surveillance program. If they're funded, if they have the time, if the students aren't on vacation, if it's not exam period, on and on. So better networks are clearly needed. The other thing that we kind of centered in on was probably if there was something that was causing serious human health effects, probably people would be able to pick up that it happened, that there was something out there. If it was a known pathogen, probably they could fairly quickly, relatively speaking, figure out what it was. If it was something entirely new, because we are talking about things coming up out of the tundra that, you know, are new to science, let's put it that way. Obviously they're old, but that might be a much more lengthy process. And, you know, we did, you know, again, kind of the issue of the fact that a lot of things are eaten raw by preference, and they are shared was an issue. So did I forget anything? Anybody want to?
Just a addition, not only to this discussion, but also earlier when sometimes we've talked about providers in remote areas, and I just want to make sure everybody's aware of the community health aid program in
Yes.
Alaska.
Yes,
So,
well, yeah, yes, my husband
there's as
actually
many
runs it for the North Slope.
community health aides as there are primary care
Well, but
physicians.
most of, yeah, there's probably, in a rural area, there's probably more. So they have a program where people are trained to be community health aides, and they start out, you can be hired, any one of you in this room could be hired as a community health aide tomorrow. And then you would get trained. And basically after you've gone through a certain amount of training, you can take temperatures. And I mean, there's 4 levels, and then there's a practitioner. So they have to go through Anchorage and rotate through a certain number of cases of different types, and they have to pass things. And they have something called the CHAM, Community Health Aid Manual. And it's now on iPads. It is updated frequently, and people have to operate per the CHAM. Now, they're also under medical control from some regional medical center, but occasionally, you know, they can't get through to them. They're not nurses, they're not paramedics, although there are some dual qualified practitioners I know that are also paramedics and even,
And many are from the village.
yeah, many of them from the villages. So this becomes an issue, you know, if you have an outbreak of something, because they're going to go home to their family, maybe before you realize that this is some highly communicable disease, and now, you know, plus they got to go take care of their, you know, so, but it's actually a very effective system. It was way better than what they had before, but it's not really designed for things that people don't know about, something new, because I mean, the CHAM is basically step by step by step. This is what you do under these circumstances with this presentation. You do this, you do this, you do this.
But like Leo, they will pick up the phone and call.
Oh yeah, they will pick up the phone and call. Yeah, that's you know, absolutely they will pick up the phone and call. But it's you know, you will probably start working through your program for a while before you realize there's nothing in here that covers that. You know, and the more experienced the practitioner is, the more likely they are to pick that up quicker. You know, just as the longer somebody's a physician or a nurse, same thing. You know, you just learn. So, anybody in the group?
Just one more question. So, in the last sentence, or last bullet there, unusual presentation, you tracked quickly for help in Alaska and in Greenland. What about for the rest of the earth? Did you guys have people in your group that knew about systems in Russia or?
Well, those just kind of came up. We didn't really have anybody that could address the Russian case, so we didn't really deal very much with Russia. Although I suspect in a lot of cases it might be very similar to, you know, more rural parts of you know, it probably wouldn't be so similar to the Finnish case, I would guess. And you run into some real issues where you have cultural differences and whatnot, certainly in Alaska and in Canada, you know, so I would imagine that at least in certain parts of Russia.
How about in Canada? We have a lot of Canadian service.
Yeah, so.
Unusual human.
But you're talking about the last bullet.
Yeah.
We
Yep.
just tell you this perfect example is the anthrax outbreak in Yamal. So the authorities, with the army and the ministry and the president's office react very fast, and we really happy to share such an experience to do such a massive operation in the very remote areas. Try to imagine it's here somewhere in Northwest Territories, not from Great Lake. What you will do. And again, Barbie, because we have this railway, we deliver
That's true.
army forces, we burn the carcasses, etc., etc. So that is and it's very, very widely open in the internet. So you just don't be lazy, you dig out, you go find out.
Yeah.
We have national system of
So
reaction.
in general, would you say if
But say Chukotka.
a few people died unexpectedly in the Arctic in Russia, do you think beyond Yamal, do you think it would be sorted out quickly?
Like say in Serenity.
Yeah, I didn't get the point, sorry.
So if you had someone who dies from an unusual illness and it's not diagnosed, somewhere in the Arctic in Russia, would it be referred up to national authorities quickly? Would it be sorted out quickly?
I would suspect so, but you always need to remember the size of the territory from all of the Chukotka, so it's hard to say.
Yeah,
It's fine with Norway, Varangiet, one.
Yeah.
In this case, it's but yeah, from Yamal, we know this was reported that at federal level react just in 1 hour or less.
But Tom, would that happen in Baltimore? One death of unknown cause?
One death, no. I'd say,
that
but
was
2 or 3
one.
young people dying in a day or two, I think it would begin to trigger alarms. You have to notice it the same cluster, but
If I'm Canada, I would speak to the challenge that was raised about high turnover and new personnel coming in that don't even diagnose botulism because they've never seen it before. So in terms of getting them to detect some new and emerging syndrome, yeah, I would have concerns about that.
Yeah, but, that might well be the case at a lot of places, in the lower 48 with roads and everything else. I mean, if you're just a GP, and you'd go with the most likely things first. I mean, the thing about, if you hear hoofbeats, you shouldn't be looking at zebras first.
Unless you're a veterinarian.
Well, yeah, okay, even then, there's horses, come on.
I think you covered this really well, but another point of discussion that was really interesting was on the trade-off between animals and humans. So a lot of the animal surveillance, there's really good technical reasons to consider that. It's often much easier legally, but then the policy and political priority is significantly lower. So it's a little bit of a political economy problem where there's, for good reason, emphasis on humans, but also some real challenges in terms of doing the work with human populations that need to be understood and recognized.
Yeah, and connected with that, there was, I think it seemed to be a commonality between the countries that what there was for wildlife in the surveillance often was much more focused on abundance and distributions, so certainly in Alaska, a lot of it has to do with hunting and subsistence, either for sport hunting or people for subsistence. They're not worrying about diseases, I mean, obviously you would pick up if, half the caribou in the state fell over dead, within 3 weeks just before you did your survey, you'd notice that. But something, not quite that dramatic might not get picked up. There was a case of muskox that, pretty much illustrates that. So anyway, I think that's it.
So we were 3 people, Arja Ratio, really good people as well, Michael Brubaker and myself. So here we are. Please, Michael and Arja, add on. So should be standard ways for reporting infectious diseases in the Arctic. And of course, in the Nordic countries, we have reportable systems. I come from Sweden, so I'm really familiar with this. I'm an infectious disease specialist. So we report diseases in Sweden and in Denmark and in Norway and in Finland, but they differ. They are not harmonized. We just published this actually, Jan, you know this. And I would really like to bring that up, the need for harmonization even of the human infectious disease, reportable diseases that we have today, because we know it's a changing world out there, dynamic processes, species are moving towards the poles, and why not report them all? And if there are 0 cases, there are 0 cases, because they're going to be bound to be cases anyway. Like TBE was reported this summer, the first case in the UK. I mean, this is a dynamic process, so why not harmonize it? And I think this is task for European CDC and CDC and also Rospotrebadzhnor, I assume, Natalia, in Russia. I think this is the public health reportable system in Russia. So I don't know who would give you that task, if it's a political decision or if it's through the Commission, or maybe you can respond to that, Jan.
So for us, it's a member state decision. So we have these discussions at the country focal point meetings that we have every year, and it's discussed extensively. The European Commission participates too, but it has to be a consensus decision, and member states tend to be conservative about what they want to report because it's a big burden on them to report another disease. So they're very hesitant to take on anything else.
Well,
so it happens. So like TBE was added, Lyme disease was added, so things are added to the list, but there's pushback from the workforce.
So the diagnostics are via the laboratories because we want the true facts, labs. So it's hard to see that it should be so very complicated. It's another thing if you want another type of reporting. And we just heard from the US then how it differs in the States. I think this is really strange, actually, Yeah. And hopefully Rospotrebazhor or Russia could consider to participate in this as well, because we have borders, yes, but microbes don't have borders. And to me, as a clinician, I find it really strange that people have to die and get sick when we have all the knowledge. It's just a matter of doing it and the will to do it. Yeah, diagnostic laboratories. Of course, you can discuss this, but this is what we said, because we want the real stuff, the true stuff. So this is what we have for human infections today. What about emerging infections? And we heard when Jan gave his wonderful lecture that it's really the biggest driver for human health is global environmental change. And so it's not really enough, we discussed, that bring in human data, surveillance of animal data, but also bring in landscape data for the true One Health. And of course, this is really something to develop internationally, and maybe CDC and European CDC will have, and the Russians here as well will have something to add to this discussion. It's food for thoughts here needed. Yeah, standard ways, absolutely. Harmonization. Get rid of the borders here, and One Health approach. And again, need to harmonize, and the dynamic processes. We need to realize that and be ahead of this. Why should we be reactive? We should be proactive. We have the knowledge to be proactive. And I like to take this opportunity when I'm standing here, that I think scientists, we have a young generation calling out. They are out in the streets calling for scientists. They say, listen to the scientists. That's us. So I think we should really respond to them in that way and tell them, yes, we hear you and we want to be proactive and do things, not just to sit and react. I think I've covered this. Michael and Arya, we were very efficient, actually.